An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.
Hello everybody, welcome to Dr. Chan's Minor Ailments Forum again. So if you listened to the last show, you probably remember that I briefly talked about type 1 and type 2 diabetes and the differences. So this time round, I'm going to concentrate a little bit more on just type 2 diabetes, how we diagnose diabetes, type 2, how it's presented, and how we maintain a good control of type 2 diabetes, and so on and so forth. So just do a quick recap before we go into further details. So type 2 diabetes normally caused by a lack of insulin, which is a chemical that needed to break down the food that we eat into useful energy for our body cells. So you could imagine lacking energy would make you feel very tired all the time, falling asleep all the time, thirsty, needing to drink a lot of water, and also passing a lot of water as well. Some people might notice that they're gradually losing weight, even they're eating well, or even having loads of infection one after another that's not healing, or wounds that are not healing and causing complications. So I would like to concentrate more on type 2 diabetes on this occasion is because I have realized that from day-to-day basis, I'm picking up more patients who's got a newly diagnosed diabetes. So you might say, it could be related to genetics. Yes, genetic does play a part, but actually lifestyles and our weight are also crucial determinators on whether we're likely to get diabetes or not. So as mentioned as previous show, if someone suspected to have diabetes, we would ask them to provide a urine sample to see if there's any glucose or even ketones in the urine. And also we'll ask them to do some fasting blood tests and maybe HbA1c blood test. Now, I'll go further into details about HbA1c blood test because it's very important in the management of type 2 diabetes. So let's just say that someone has the symptoms that we mentioned earlier on. The blood test showing a random venous plasma glucose concentration of more than or equal to 11.1 millimole per litre, or a fasting result of the same blood test of more than or equal to 7, then that would be enough for us to say that this patient probably has diabetes. But a glucose tolerance test can also be done to confirm whether someone has got diabetes or not. In the last show, we briefly talked about it, which is basically doing a fasting blood test first and then have some sugary drink, which is normally done in the hospital, and they provided the drink for you. And you have to wait for 2 hours and later have another repeat blood test. And if after 2 hours the plasma glucose concentration is more than or equal to 11.1 millimole per litre, then that would be enough to confirm that someone has diabetes as well. But you see, sometimes we do blood tests to do a screening, really, for diabetes, and not because the patient's presented with symptoms, but they might say, oh, my father recently been diagnosed with diabetes, so I really want to check whether I could be at risk or not. And in that case, those patients might not have any symptoms. So if you get a one-off abnormal result, we normally repeat it again, and if they both are abnormal and fit into the criteria, then we would be able to say that the patient have diabetes. So many of you who had actually had the oral glucose tolerance test might say, you know what, I had it done. It's really annoying that I have to do a fasting blood, so I could not eat for 14 hours the night before. Then I have a sugary drink and have to hang around in the hospital for 2 hours. Well, are there any other tests that make it easier to diagnose diabetes? Well, I've got good news for you. So recently, the WHO released a new guideline on how to diagnose diabetes with a blood test called HbA1c. If you're diabetic, you probably would be very aware of this blood test and what it means, but maybe for most of the population, it probably doesn't mean anything to you. So I'm going to spend some time of explaining this blood test and how to interpret it. So HbA1c is an abbreviation. HB is a very common abbreviation that we use in medical field, and it stands for hemoglobin. And the A1C bit is a specific subtype of hemoglobin, or it has another name called glycated or glycosylated hemoglobin, A. So this blood test is extremely useful to see the control of diabetes because Most of you are aware of checking blood sugar using a finger prick test and put a little bit of blood on the test strip, and they will read out the results straight away. Let's just say 5 point something or 7 point something. Then you know how your blood sugar is like at that point in time. Now the HbA1c is different. It doesn't deviate just because you haven't been eating today or you've been eating really healthily. You probably might think that this number might come down. No, it doesn't work like that, because this is like a computer system recording how your blood sugar has been controlled for the past 2 to 3 months. So short-term changes of the lifestyle or just changing it before the day of test wouldn't deviate this number at all. So the WHO suggested that if someone HbA1c is more than 48 or equivalent to 48, that would be recommended as the cutoff point for diagnosing diabetes. But you have to bear in mind that a value of less than 48 millimole per mole, it doesn't mean that you don't have diabetes. That might also mean that you need to do the oral glucose tolerance test to further testing and confirm about the diagnosis. Now, while using HbA1c to try to diagnose patient with diabetes, in some situation you might not want to use HbA1c to do, especially in children or younger people, or you suspect that patient might have type 1 diabetes anyway. Sometimes some patients are on some medication that might cause a raise of glucose rapidly, for example, being on steroids or some antipsychotics medication. And people who are pregnant or anemic, these tests wouldn't be accurate either. So this test has to be used in practice carefully. So let's just say you're diagnosed with diabetes, and you might ask, well, does it mean that I have to be on tablets straight away? Because I heard that, once you're diagnosed, this is it. Well, the answer depends on the severity of the diabetes, or like the HbA1c when you first present it. So ideally, the blood sugar reading or the HbA1c reading for a well-controlled diabetes should be between 45 to 55. So this is a relatively new number, because in the past we're all looking at a single figure. So I'm just going to give you some old numbers as well. So in the old number, it will be equating to 6.3 to about 7.2. So let's just say when you were first diagnosed, your number fall between, 48 to about 54. For me, I must say to you, look, let's go and try it by looking into your diet and lifestyle, because we all know that the diabetes numbers are going up. Type 2 diabetes numbers are going up. It's because our lifestyles are generally good, but we don't do much exercise because of our jobs, and that leads to a few more pounds around the waist, and that puts you at a higher risk of diabetes. So for someone who's, for example, overweight, or they're having very poor diets, I might suggest them to be on diet control first, at least for the first 3 to 6 months time, and we'll keep an eye on the HbA1c. And let's just say if this is not working for the patient, or they've tried everything to change the diet, but the situation is still the same, and if not the HbA1c actually going up, then we have to think about starting medications. So you might ask, what is a diet for diabetes? Like, what do I have to eat something completely different to other people? No, not at all, actually. And basically, the diets for type 2 diabetes should just be healthy eating, and also focus on or avoiding the food that kind of make the blood sugar shoot up straight away. So that would just basically involve eating a variety of vegetables and making sure that you have a good intake of unsaturated fats, for example, nuts and oily fish. If you go onto NHS website, or even patient.co.uk or Diabetes UK, you'll be able to find loads of information on diets for type 2 diabetes, and some of the websites actually provide different menus for you to try out for healthy eating as well. So that these are really good resources for us to kind of explore a bit more on what to eat. However, different people are different, so we always recommend that you should do a regular blood sugar testing, like the finger prick test that I mentioned earlier on, especially before and after meals, to see how your blood sugar shoots up after different things that you eat. Because those that cause a massive surge of glucose after being eaten, are probably the kind of food that you should avoid or cut down on. So it's not just the carbohydrates that you need to look into, but also the fat, saturated fat, salt and sugars content that you need to look into as well. So I always ask my patient to have a habit of reading the back of the pack of the food. They normally tell you the energy level and also how much salt and sugars and fats they contain, so that you can actually make a judgment on whether this food would be good for you with a diabetes diagnosis. So as you know, apart from diet changes, we need to look into the lifestyle as well, because let's just say if you're overweight, you contain more adipose tissue in your body, and that actually causing insulin resistance. And it doesn't help with the diabetes at all. So number one thing we should do is if you're overweight, we should really try to kind of increase the exercise level and trying to lose a few pounds, because I've seen it so many times that newly diagnosed diabetes and the HbA1c are not too bad, and by changing the diet and lifestyle and do a bit more exercise and losing a few pounds, the HbA1c drops. And sometimes I've seen some that was on medication before that they can actually step down because they've done so well. So we should never see diabetes as, now I've got the diagnosis, it's just going to get worse. No, if we work on it, we can actually revert it back. Not saying that you wouldn't have diabetes then, but actually saying that you would have a very well-controlled diabetes. You might not need to be on so many different kind of medications or insulin injections. So let's say when the disease progresses and medication is needed, what do we start the patient on first? And then the number one things that we start first would be a medication called metformin. So I suppose even people who are not diabetes might have heard about this medication, because it's quite a common medication that we start people on. So this medication helps to decrease the hepatic glucose production. And interestingly, this medication is not only used in diabetes only, but also used in some other gynae condition. For example, polycystic ovary syndrome, a patient who has got subfertility, because part of the action of this medication is also help you to lose a little bit of weight. That in turn will reduce the adipose tissue in your body and also make your body more sensitive to insulin again. I must say this medication is normally really well tolerated, and obviously all medications have side effects, and the most common one that people complain about, it would be a little bit of a loose stool, but most of the time people get used to it in times and the side effect will go away. But for those whose symptoms are ongoing, having loose stool, that's actually quite annoying for the patient. So there's a new version, which is a slow release version that promised to reduce the gastrointestinal symptoms. Now, I always tell my patients not to be surprised that in this diabetes journey that medication need to be added on and medication need to be changed, because that's how diabetes progresses. And eventually they will all need to be on medications, and not just 1, 2, sometimes 3 or 4 different things, depends on how the control is like. I think it's a good idea for me to kind of continue this story next time, but to talk about different kind of tablets apart from metformin, and also a non-tablet formats, because recently we have really good news that we can do once a day injection, which is not the same as insulin for type 2 diabetes who are not very well controlled. And in fact, from personal experience and my feedback from my patients, they really loved the injection. So I would like to spend some time to remove the fear of needing to be on medications, because as we know, if diabetes are not well controlled, it can lead to a lot of complications. So I hope that the last 15 minutes haven't been too heavy for you. But I feel that we all need to know a little bit about diabetes in order to prevent it, and if you do have it, to maintain a well-controlled. So next time round, I'm going to talk about different kind of treatments for diabetes type 2 and also the new medication that's out there. And until then, have a very, very good week. Thank you. Bye-bye.
An opportunity for discussion. This is the 15-Minute Wonder on South Waves Radio.